There's also studies to show that there's a decreased risk of leukemia in children and obesity. For moms, we're seeing decreased in postpartum depression if they're breastfeeding, also decreased rates in diabetes, and so also decreased rates in ovarian and breast cancer. So as you can see, there's really good reasons for a woman to bond with her baby and do this natural feeding method.
Well, I know sometimes with formulas, babies like one formula and not another, and I know some babies seem to prefer the left side because it's chocolate to the right or whatever. You can fool them by doing a little football hold. What are their qualities to breast milk in terms of calories? I mean, it seems like some of my babies end up skinny little guys on breast milk, and some are chubbier. And does breast milk have different calories to it sometimes?
Yeah, the fascinating thing is breast milk's more like a living biological fluid. It really changes, and it changes mom to mom, and even with the same mom and baby, almost minute to minute. Sometimes you might have more hind milk, that's the fatty, rich part of the milk, and so you could have a mom who has 33 calories per ounce of breast milk. Just for a comparison, Dr. Landon, formula is only and always 20 calories per ounce unless you've ordered a special formula for your patient. On the flip side, there could be more dilute milk, a higher presence of fore milk, and so the calories can drop, and there unfortunately are some women who have low-calorie formula, maybe as low as 15 calories per ounce. So there can be some variation. I want women to understand that it can fluctuate. Just because one meal may be low in calorie doesn't mean that all of them are. However, if you're seeing that your child's not thriving, not gaining weight, or if your doctor's concerned, there's definitely reason for us to look at what's going on.
Are there any medications, if a mom is on medicine, that she should avoid while she's breastfeeding? Or is there a resource where if she talks to her pediatrician or obstetrician, can they help her to know whether that medicine will pass through to the breast milk to the baby?
Absolutely, Dr. Landon. There are some medications that are 100% safe for a woman to have while she's breastfeeding, and others that absolutely should be avoided while breastfeeding, or a pump and dump sort of attitude if a woman needs to be on a medication. The pump and dump so that she doesn't lose her milk supply while she's on that medication, but then we're not giving any risk to the baby. There is a book that your physician may have called Medications in Mother's Milk by Dr. Hale. This is a great resource. As you can see, it's fairly thick, and so there's wonderful information here. There are some medications that it could be questionable how safe it is, so there might be some guidance in terms of when to dose the medication for mom, so that she can understand that maybe she takes her medication after a breastfeeding session, and then that way by the time the next breastfeeding session comes around, a lot of the medication has left her system.
And how about with illnesses? Sometimes we have mothers who have HIV positive or have hepatitis B. Are they able to breastfeed, or?
Well, in this country, we actually don't have HIV positive moms breastfeed. We have a lot of medications, and there's alternatives for us for these children. In other countries where there isn't as good a treatment, these women are encouraged to breastfeed. In Africa, for instance, because the rates of malnourishment and death for these children is far higher than if a child were to contract the HIV virus. So there are certain limitations. One of my frustrations is I see a lot of moms who will come to me and they just had a common cold and they stopped breastfeeding, and they stopped breastfeeding for about a week because they were sick, and now the baby fusses because the milk supply isn't as abundant as it was before. And what I'm trying to get these women to understand is that you can breastfeed through a cold. If they're going to do over-the-counter remedies, they should be talking to their doctor, because there are certain cold medicines that are going to be okay and others that are not. However, being sick in and of itself is not an indication to stop breastfeeding. In fact, you'll be making antibodies that you'll pass on to your baby to help keep them healthy.
How about recreational drugs? If someone smokes marijuana or snorts cocaine or takes amphetamines, does that pass through the breast milk into the baby?
Several of those will have effects on the baby, and of course we'd like to encourage our moms to not be breaking the law and taking care of themselves, but for certain of these medications it's going to be, or drugs actually, it's going to be very important that a woman avoid breastfeeding. For other medications and drugs, it's not as problematic. Again, it's going to depend on frequency of use and amount of abuse. And so that's something to know. Even alcohol, if you have a woman who does an occasional glass of wine, it's not going to be a problem. However, we need to make sure we both define occasional on the same wavelength.
Well, are there any local resources, any support groups or that kind of?
Absolutely. There is the Breastfeeding Coalition of Ventura County, and they have a website that you can visit, and they have a list of resources there. I will be in the new directory for 2009. We also have Marissa Montgomery, which we're very lucky to have at VCMC. She is our lactation specialist. She has a phone number as well that you can reach. So there's plenty of opportunities to seek out help.
What other resources might be available besides a support group like that? If I wanted to make an appointment in your office, how would I go about doing that if I were a physician or a mother?
Absolutely. We love to get referrals in because working with the breastfeeding dyad can be challenging. As a physician, you have a lot going on in your day, and you may not know exactly what to do with this woman who's having difficulties. So the most important thing is ask, and if they need help, refer. We do take referrals, and right now what we're asking is that a physician refer both mom and baby, because we do look at the baby's mouth. There are certain anatomical problems that can be causing either mom to have pain with breastfeeding or baby having difficulty actually latching well. And then as well, we look at mom's breast to see if there's any problem with her nipple type, and then just work at putting both together. So as a physician, just call Mandalay Bay Women and Children's Medical Group, and my staff will be happy to make an appointment.
Now, the word pain has come up several times, and I know, as we'd spoken earlier, that can be kind of a halting factor. Could you just advise me if I say, gosh, Dr. Patty, this is really painful. My baby just chews on my nipple, and I just really, I can't go on breastfeeding.
Well, what I'm going to tell you is let's talk about how you're holding your baby and how your baby's actually latching on. Pain is mostly brought on by an inappropriate latch, and that's referring to how the baby's actually holding on to mom. Most women think that the baby should only be on the nipple, and that's probably the most common thing that we see. The baby who's solely on nipple is going to be causing a lot of trauma to mom, and that's where cracking and fissuring will start coming. And some of these women are such troopers, Dr. Landon, they're trying to work through the pain until they come in tears and just can't take it anymore. So what we have to do is really figure out how that baby's latching, try different holds, and oftentimes that in and of itself can help the problem. If we're still not getting to the solution, what we need to do is, again, maybe mom needs to pump for a couple of minutes. If she has slightly inverted nipples, pump for a couple of minutes to help pull out the nipple and then attach the baby so that baby's not causing all of this trauma.
Okay, can you tell me maybe about another kind of problem that's come into your office in terms of breastfeeding, besides pain? And what if there seems to be poor milk production? What are the kinds of things that a mother can do? I hear they're supposed to drink beer so they make more fluid.
Well, there are some recommendations. Drinking beer is not among them at this time. However, we do want women to be well hydrated. Drinking lots of water is going to be important. Eating oatmeal actually can also be very helpful to try and help boost milk production. There are also some galactagogues. Some are herbal medications that mothers can try. Fenugreek and mother's thistle are a couple of options that women can seek out. And we also use Reglan, and that's one of the things that I recommend for the women to talk to their primary doctors about trying a course of Reglan.
All right. Well, that you really offer quite a service to the community, and I think we were able to make all those phone numbers and websites available. Dr. Patty, thank you so much for joining us today. We're going to be right back.